Hello, and I just want to announce that, again, this is the webinar for Magellan, part 2, a conversation with Magellan Understanding Dual Diagnosis and Behavioral Health. And we have a brief disclaimer. The ARC of Lehigh and Northampton County's Advocacy Department does not employ lawyers nor provide legal advice. This training or any other provided by the ARC Advocacy Department does not consult or imply the endorsement, recommendations, or favoring of the providing parties or any employees or contractors acting on its behalf. This webinar is being provided for an educational and informational purpose only. With that being said, it is my pleasure to introduce our guest presenters, Danielle and Kristen from Magellan Behavioral Health of Pennsylvania. The Zoom is yours.
Hi, everyone. Good evening. We are so happy to be here tonight. I just wanted to take a minute. We're going to introduce ourselves. Kristen, can you go to the next slide?
So I can introduce myself. Oh, sorry. I was on the top. I thought I was going to go first.
Go ahead, please do.
All right. So I'm Kristen Scalise, and I'm the manager of the clinical care services, specifically within the Children's Outpatient Department here at Magellan. Good evening.
And my name is Danielle Dolena. I am a senior care manager working specifically with our members that are dually diagnosed with an intellectual developmental disability. That's for children and for adults. Kodi had already shared some of this information, but our agenda for tonight, we're going to provide an overview of Magellan and what our role is as a behavioral health managed care organization. We're going to talk about dual diagnosis. We are going to talk about some resources for individuals with dual diagnosis, how to find help and treatment. And then we're also going to talk about some resources beyond Magellan. And then we're going to leave some time at the end for questions and answers. The information that we are going to present tonight, just so that everyone knows, is pretty broad of a topic. We hope to provide some general information, but please know everyone's needs are different, and so there will be an opportunity for a review of how to reach Magellan if you have a need to speak with somebody about more specific needs. So again, just keep in mind that this is really very general information, a broad overview. So as I said, Magellan is a behavioral health managed care organization. We serve several counties, including Bucks, Cambria, Delaware, Lehigh, Montgomery, and Northampton counties. We work quite closely with our county partners, but also just as closely with members and families and treatment providers in our local community. Generally, Magellan serves all Health Choices eligible members. Part of our role is to review medical necessity criteria for level of care requests. So in a typical situation, we might receive a level of care request from a treatment provider, and we review that request as it relates to medical necessity for that level of care, and then we coordinate with the providers going forward. Additionally, Magellan, as I said, we do certainly partner with our counties as well as state stakeholders, the Office of Developmental Programs, the Office of Mental Health and Substance Abuse Services as well. We generally will do a lot of coordination of care as it relates to serving and supporting our members that have different types of needs. Next slide. So we're going to spend a little bit of time talking about what it is when I say dual diagnosis. Please know the term dual diagnosis can be used in different ways. I have seen it apply to different types of diagnoses, but for the purposes of our discussion today, when I say a dual diagnosis, I mean what refers to as individuals with an intellectual developmental disability who also concurrently experience a mental health condition. Generally, there is not specific numbers, but it's generally thought that approximately up to 35% of individuals that have an intellectual disability may experience a mental health challenge. Those are numbers and information that came directly from the National Association of Dual Diagnosis, which is a really great resource in providing knowledge, resources, information, trainings, all related to dual diagnosis. I want to spend a little bit of time just in continuation of that overview of dual diagnosis, talking a little bit about prior to somebody being diagnosed with a dual diagnosis. I just wanted to highlight for those that are joining us tonight that may be questioning that a little bit more. When it relates to a mental health condition, we sometimes see individuals start to display subtle changes. So if you are a caregiver and you're supporting a loved one that's starting to show maybe subtle changes in their sleep, their behavior, their appetite, their interests, we generally encourage that people will go and be evaluated by a doctor. Please know that just because the loved one might be showing some subtle or sometimes not so subtle changes related to their functioning, their behavior, that doesn't necessarily always mean a dual diagnosis. Please definitely know that. It could be something else, something underlying like a medical condition, increased stressors, changes. Generally what we'll see is that if someone is brought to their healthcare provider, their doctor, due to some of these subtle changes, doctors will usually rule out any underlying medical concerns. As you can imagine, medical concerns can certainly be manifested through outward behavior, and so that is something that the practitioner will generally rule out first before making that diagnosis. But again, we very much do encourage that if you have a concern that someone that you're supporting or your loved one possibly has a dual diagnosis or is potentially displaying some of those subtle changes that I had talked about, we encourage that you talk to your doctor. The intention would be to try to get a more thorough evaluation, to try to figure out a little bit more what could be causing some of the changes that are being displayed, come up with a care plan for how to help the loved one. These evaluations can be done at any time, but certainly they are most helpful when you start to have any concerns or see any of those changes. When we say talk with a doctor, that can be a really vast area, considering our medical field is pretty expansive. As a starting point, a lot of families will generally start with their primary care physician or their pediatrician. That's usually, as we know, our first point of contact. And so that discussion often starts there. There are additional specialists in the medical world, as we know, developmental pediatricians, neurologists, as well as psychiatrists and psychologists. We do know that sometimes those specialty practitioners, there can be a bit of time, a bit of wait before you're able to get that appointment, which is why we do see people sometimes start with their primary care physician, but wanted to highlight all of those specialties, all of those resources as a general starting point. Additionally, early intervention is a great resource for some of our younger members before the age of 3, as well as our intermediate units that are there for ages 3 and up. Next slide.
All right. So now I'm going to take over and talk a little bit about some of the behavioral health services that are available through Magellan, specifically trying to highlight ones that may be accessed more by this specific population. But as we'll say at the end as well, is that there's other levels of care as well. We're just trying to highlight a few of them. So I am getting over an illness, so I'm going to try my best not to cough. Otherwise, Danielle's going to have to jump in here. But So we start with some outpatient providers, and outpatient, they can provide, one-to-one therapy. They can do family therapy. There are some providers that offer some group sessions, as well as access to a psychiatrist who may look to prescribe some medications depending on what the need is. We used to say this was only done in the office, but now, since COVID, there has been even more expansion of something called telehealth. Um, and even that has changed when it was offered in outpatient before. So you do have a little bit more flexibility with how you access outpatient services. For our younger members, there are outpatient services available in some schools. We have that connection with some of our schools. Some of our outpatient providers also offer some social skills group programming and a specific treatment, evidence-based treatment called parent-child interaction therapy, or for short, sometimes they say PCIT. And that's another kind of specific therapy providers. So that might be one level of care that somebody might access to assist them. Another one would be psychiatric rehab. We've done some work a lot in the last, I would say, 2 years in Lehigh, Northampton, working with our psychiatric rehabilitation providers. We have a good handful to expand and enhance their ability to work with members who are on the autism spectrum. So this is a service only available to members that are 18 and over, but it is a great service where it talks and teaches about skills in living, learning, working, socializing. They can provide some of the services at home, or you can go on site and do this. And again, it's a very member-driven service. They decide what things they want to work on and enhance. They might spend some time learning how to create a budget for themselves, how to manage living in an apartment by themselves, what skills might go from that. How do I enhance my job interview skills, things like that. Those are all some of the things and goals that might be worked on in a psychiatric rehabilitation level of care.
Kristen, I just wanted to highlight for psychiatric rehab that can be center-based, as well as some providers do also offer mobile. So they're out in the community, things like that.
Yep, thank you. So another service is intensive behavioral health services, or IBHS. This is a service that is replacing something called BHRS, or behavioral health services. BHRS actually stopped being an available level of care in January of 2020. 2021. And now we have had for the last year or two IBHS. So there's been some changes on this. This is for children under the age of 21 that they can access the service. This is generally a community-based service. They can support the member in their home, within a community setting, within a structured school setting or daycare setting, wherever the needs are presenting themselves as far as the behaviors or the skills that are needed. There are sort of 3 divisions within this service. One is ABA, or Applied Behavior Analysis, which is a very structured system of addressing behaviors and enhancing skill development in a very data-driven approach. There's some group services. So they may work on behaviors or the skills within some type of group on site at a provider, after school, once a week, things like that. And then there's individual services, which again might be more in line with what people remember from BHRS. Again, they can provide support and services around behaviors and supporting families to better support a member who's demonstrating some type of behavior. So this is one level of care available to our younger members. Another one would be Transition to Independence Program, or TIP as sometimes it's called. And that can be accessed by members who are 16 to 26 years old. So that transition age, as we like to say. TIP is a program that engages the young people with their planning for their future. So again, very similar to like a psych rehab, we're very focused on the member driving the goal plan. Or futures plan, as they like to say. It's like a roadmap to being successful and independent in their future. They also focus on some key areas like educational opportunities, employment, career, their living situations, functioning life in the community, personal effectiveness, well-being. So based on those general topics, the member would create the goals that they want to accomplish, and the team would help support them to do that. And if they accomplish a goal, then they create another one and things like that. So again, specific with that transition age population to support them from that sort of children's system as well to an adult type system, and what kind of goals that shift might encapsulate. And then we have another one called the Transition Age Youth Certified Peer Support, TAY, ages 14 to 26. So certified peer support for this age works with those young people to identify community resources, develop the life skills that they might need on that transition age, help with social support planning, again, from somebody who can relate, hopefully, and help them support in that transition, which can be a challenging time to navigate. And this is somebody hopefully who can assist them better and support them. Some a little bit higher levels of service, so providing even more sort of intensive clinical support would be something called family-based services. And that would be accessed by members up to the age of 21. And this combines individual and family therapy work. It does have a crisis component. So if there is a time frame where this family or that member is in a lot of crisis, they can access this service to provide that type of crisis support at that time. This service also does a lot of case management. That's another large component of that service. Some of the children that might access this are ones that are maybe at risk for going for an out-of-home placement, or who have just left a placement. And it's a very tenuous circumstances. The family is definitely the focus of the service on an individual, and then as a whole family component. There's a very strong model behind it, and it's about 8 months of that specific service. Another pretty supportive high level of support is called a partial hospitalization program. We have a couple variations of what that looks like. So there are partial programs available for school-age children, short-term and long-term, and as well as for adults. So it is a service that may look a little different, but it is available throughout the continuum of ages for our members. Generally, it'll be 5 days a week for several hours a day. Again, it's a pretty intensive and supportive service. It does consist of individual groups and family therapy work. They really want to support what's happening for the member, but also understanding the environment around them and the supports that support them, and being able to address that. So in a caregiver, family supportive way. There is a psychiatrist on staff that also is actively reviewing medication if that's an issue, and making adjustments as needed, again, to help stabilize and really try to maintain that member with as much support in the community as possible. And then we have our dual diagnosis treatment team service, which is called
talk about this
DDTT. Yes, I will turn it over to you.
Yep. So DDTT is a time-limited, very intensive, community-based treatment service for dually diagnosed individuals. And it's really intended for those individuals that have the highest level of need. So those that may have had multiple psychiatric hospitalizations, maybe at risk of losing their community placement. So for example, maybe they live in a group home setting, and due to the intensity of their symptoms and needs, they might be at a point where the group home is saying, we don't know that we can continue to serve this person. Generally, DDTT will get involved at that point and do intensive treatment that is community-based, but there's several individuals on that treatment team, including a psychiatrist, a nurse, recovery coordinators, a behavior specialist, as well as a master's level clinician. And their intention is to work with all team members to help to understand dual diagnosis, help to understand how to support the individual, and then of course to assist the individual in stabilizing their symptoms and increasing what we refer to as community tenure. So time successful in the community without hospitalizations. DDTT is very intensive, and also slots are limited for Lehigh and Northampton counties. So that's a service that generally gets referred by some of our county partners, or when we start to see sort of that higher level of need. So that would be something that we would encourage people to outreach to Magellan about if they had more specific questions, because it is a bit of a limited program.
So two more higher levels of service are a residential treatment facility. And again, in RTF, sometimes it's called, for our members up to age 21. And this is for children who have and are presenting with some severe mental health symptoms, and to a point where they are requiring to be removed from their community and home environment. This is typically only used as sort of our last level of resort. We certainly want to support the member as best we can in their home and in their community. But if services in the home and community have not been successful, this is something that is an option. In the RTF, they would use individual and group therapy, and certainly have an essential component for that family and caregiver involvement, because the ultimate goal is to transition them back home and into the community as soon as it's possible. So it does involve 24-hour care residentially where they stay, receive treatment and support and therapy, and then hopefully would be able then to discharge back home when some of the severity of the symptoms decreases. And then a psychiatric inpatient hospitalization that is available to our children and adult population. This provides 24-hour treatment in a hospital setting. Primarily that is focused on those who pose a danger to themselves or somebody else. And it is meant to be very short term to help reduce or eliminate that danger, or decrease the symptoms so that their functioning has increased and they can go back with their supportive community services. And then, as we kind of said before, we're touching on a lot of little things and not necessarily going so in depth into everything. So we wanted to make sure that those of you on the call are aware of some additional ways to ask more questions if they come up, or things that you would want to continue to look into. So we do have a member handbook on our website, and the website magellanofpa.com is a really great resource. It has a member page and a provider page. You can find the member handbook. You can find a lot of links to additional resources and additional information, things like medical necessity. A bunch of things can be found on that. So if you have some time, that's a really good resource to peruse. And then we have listed on here, and of course it's on the website as well, the phone number for our member service line. So certainly anytime that those questions come up and you feel like I need to get some more information, you can give that number a call. Our customer service representatives are happy to assist you as best they can. If they can't answer the question, they'll actually connect you live to a care manager who can better assist in answering your questions. So hopefully that's a good resource if that ever comes up for you down the line.
Before we go on to additional resources, I just wanted to highlight one other thing regarding the behavioral health services that we had reviewed. As Kristen had mentioned, that list was not inclusive of every single level of care that's covered by Magellan. We tried to instead highlight those that might be utilized with individuals that have an intellectual or developmental disability. That said, though, we recognize that sometimes people do have primary insurances and Magellan would be secondary. So we would just say that if you do, in fact, have a primary insurance, we would encourage you to also outreach them if you're trying to explore services for your loved one. But again, we're certainly always available to answer any questions and provide additional information. So moving on to discuss some resources beyond Magellan. As we had talked about at the beginning, Magellan is fortunate to have a lot in partnership with external service systems. So our partners at the state level, as well as physical health managed care organizations, as well as other advocacy resources and groups intended to support individuals with dual diagnosis. As I had shared earlier, early intervention is certainly a fantastic resource for our youngest members. And then the special needs unit are offered through the Physical Health Managed Care Organization. So as we had discussed, Magellan specifically oversees the behavioral health and substance abuse services for individuals, health choices individuals in Lehigh and Northampton County. But concurrently, there's also a physical health plan. And so that can vary depending on the individual. But generally, we will encourage people to outreach to the special needs unit if they have a medical condition that requires additional care coordination and follow-up. So, for example, if it's a member who has a mental health challenge but also has unmanaged diabetes or another chronic health condition that they're struggling to manage themselves, maybe they're struggling to get to their appointments or understand their medication, things like that, then we will certainly encourage that people try to outreach to the special needs unit depending on what their plan is.
And I was going to add something about early intervention based on the conversations that I have sometimes with some of the younger folks and maybe the delays in being able to access something like a developmental pediatrician. Early intervention, what's great is they don't actually work off of like the diagnosis. That is not their role. They work off of the presentation and what's being presented, figuring that piece out. So they can still support somebody if they qualify, even if and without any formal type of diagnosis. So sometimes people think that that's going to be a barrier, but not in the world of early intervention, which is nice.
Moving on to additional resources with our counties. So as I said, we work very, very closely with both Lehigh and Northampton County, and the county has specific departments that are intended to focus on an identified need. So we have Lehigh County Human Services, the overall department, as well as Northampton County, but we also did include in here information about the intake and referral units for both of those counties. We frequently get calls from families just asking about that. You know, I think that my loved one may need some additional habilitative support or whatever the case. They're not already linked with the county. We certainly do encourage them to make that call and start that discussion because ultimately they'll be able to say specifically what's needed to start that process. And then we did also highlight both of our counties' emergency services, again, as another resource for really the highest level of acute needs. So if there's a behavioral health crisis, those are two phone numbers that can be utilized based on the county. Next slide. And then finally, we wanted to highlight some state resources. We included information about myodp.org for those I'm sure that many on this call are familiar with the Office of Developmental Programs, but myodp.org is just a phenomenal resource when it comes to offering training, online resources, and really just sort of keeping your finger on the pulse to what is progressive as it relates to dual diagnosis. They have a whole section on that, but really just a great resource. As well as ASSERT, which is intended to provide services related to autism education training. We also give out this resource very frequently to families that call, families that are sometimes looking for parent support groups, wanting to be connected with others or be connected with more information about autism training and resources.
Let me just interrupt for 1 second.
Yep.
And because I'm also thinking of Susan's question, ASSERT is another good contact to outreach. They often have directories based on different areas for things like we get calls about, is there a special daycare that is sort of more in tune to assisting a member with autism? The blood work may be something that they also have some resources on. I'm not 100% sure, but I know they field all kinds of questions from parents about different areas and different supports within the areas. So that might be another resource to try.
Yeah, on the other end of that continuum, I will say that ASSERT also has been doing a lot of research and support around individuals with autism that have interactions with the law enforcement system. So we know that unfortunately occasionally happens, and so they're seeing it occur more often. And so they have been really great in terms of training law enforcement, the justice system around someone's needs when it's related to autism, how to support that person, just to gain that better understanding. And I think that they've had some pretty good success with that. So I highlight that just again to really note their range of services and supports that they're doing statewide as it relates to autism. And then finally, we did include the IBHS research page for the state. Magellan has a whole page dedicated to IBHS because it is such a comprehensive service, but we also included the website, like I said, at that state level as well. Kristen, what specific resources would they see?
Well, they would be able to find like a search tool more specific for the entire state. So if they're moving or something like that, they may want to be able to go on that website, punch in the service, and the next county or the next state. Ours might be more specific to our needs. There's a plethora of information on the state's website. I think they did a really nice job in having resources available for families as well as providers during the transition from one service to this service. So it's a good website.
And then next slide, I think that brings us to
Questions.
Yep. So again, we want to stop here, and we wanted to be sure that we left time for questions because again, we shared really broad topics tonight, a lot of information, but please put any questions in the chat. Feel free to let us know if we need to clarify anything.
Great. Thank you both so much for your time. This was a really great overview in seeing all of the comprehensive services to support dual diagnosis and behavioral health that are available to our families.